de tweede keynote vandaag gaat gegeven worden door Kristian Thorborg. Ja. We zijn zeer blij om Kristian vandaag te mogen verwelkomen op dit congres. Voor degenen die Kristian nog niet zo goed kennen, Kristian is een absolute wereldautoriteit op het vlak van kinesiotherapie en revalidatie. Kristian is werkzaam aan de Universiteit van Kopenhagen in Denemarken. Hij heeft enorm veel gepubliceerd wetenschappelijk op het vlak van vooral heup, lies, hamstrings problematiek. En hij gaat ons daar vandaag ook meer over vertellen, over oefentherapie naar preventie toe en revalidatie van deze vaak moeilijke blessures, hamstrings en lies problemen. Misschien interessant ook, Kristian is ook voorzitter van de Internationale Federatie van Sportkinesiotherapie. Ja, dus niet de eerste, de beste die we hier vandaag hebben kunnen strikken. Maybe I switch now in English because I think, Kristian, can you hear me?
Yes.
Okay, very good. So Kristian, first of all, thank you to be here today. Yeah, it's a big honor for us to have you here in Belgium. And I just introduced you. I only say the good things, of course. And we're really happy to learn more about your expertise and your knowledge, both in research and in clinical practice, on hamstrings and groin injuries. So the online floor is all yours, Kristian.
Okay, first of all, thank you to the Belgian Federation for inviting me. Thank you, Van Dingen, Dr. Dingen, for this nice introduction. Yes, my name is Kristian Thorborg. I'm from Denmark, Copenhagen. My background is I'm a physiotherapist. I've been a physiotherapist working for 22 years now. But I've been playing football almost all my life. I've been involved with football all my life. So first as a player, still playing a little bit, but probably not at the same level anymore, but also as a coach, as a physical trainer, and now also in research in relation to injuries. So it's a big part of my life, and I'm very glad for this invitation to speak about two of my favorite topics, which is using exercise in prevention and rehabilitation, especially in relation to hamstring and groin injuries. So thank you very much for the invitation. So the evidence is actually pretty clear now, especially in relation to the prevention of hamstring muscle injuries. And as can be seen from this graph, it's quite effective to actually use exercise in relation to prevention of hamstring injuries in football. And it can be used in different ways, but actually it shows quite dramatically that in isolation, Nordic hamstring exercise, the Nordic hamstring exercise protocol is very effective in reducing injuries. Up to between 50 and 70% has been shown. And also if you include the Nordic hamstring exercise in a FIFA 11 Plus program, which is a more sort of multimodal program, including more exercises than just the Nordic, again, you have an effect estimate around 50% reduction in injuries. So again, there are some really good injury prevention programs out there for hamstring injuries, and a lot of them, or all of them actually involve the Nordic hamstring exercise. And I'm going to talk a little bit today about why it is that this kind of exercise works, and also because this can help us in improving our knowledge on how to prevent not just hamstring injuries, but muscle injuries in general in the lower limb, also in relation to football injuries. And I will also show you how this has developed our understanding of trying to induce relevant interventions for groin problems in football as well. So as you probably know, hamstring injuries and groin injuries are two of the main problems in football, not because they are the most severe injuries, but simply because the incidence and prevalence of these injuries are very, very high in football. Generally, if we take the hamstring injury first, I think the most important thing to understand is that a hamstring injury is actually not really a muscle injury. And even though that sounds a little bit contradictory, I think the main idea and the main concept that we need to understand is that the location of the muscle injury is actually located at the myotendinous junction. So actually in a tissue that is not purely muscle tissue, but actually is more collagen in origin, and is made of this junction between the tendinous part of the muscle insertional tendon and the muscle part, and you have this collagen tissue in between, which is very, very effective actually at distributing forces when muscles and tendons are loaded in relation to sports, and specifically also in relation to sprinting and kicking in football. What you can see here on the right is actually these are the tendons for the hamstrings, but you can see that these tendons actually run intramuscularly through the muscle, and then of course becomes tendon in the end here as well. So basically just to say that you have this intramuscular tendon going through both of the hamstrings, and most of the injuries actually occur in relation to this structure, so in relation to the myotendinous junction, so the junction between the muscle and the tendon. Here on the left, you can see a picture of how that looks in a laboratory, where you actually see the muscle tendinous injury here, and you see the retraction of muscle tissue in relation to the collagen, and you also see the C fibers here. And basically these fingers here actually is what is forming the collagen tissue in relation to the myotendinous junction, and you can say this is where you have, if you can increase the cross-sectional area of this collagen tissue, you are able to actually withstand or absorb more load in this region, and you should be better protected against muscle injury. Myotendinous junction injury, that is. Again, here's a very good picture from our lab in Copenhagen, where they've actually done some really good work in relation to the myotendinous junction. And here again, you can see how this junction and how this blue part actually sort of has this rich grip, finger grip, and again, which works almost like a Velcro type of clinging between the muscle and the tendon, and you get this myotendinous junction. And again, the more cross-sectional area you have, the better grip you have with the fingers. The more area you have with grip, the more protected you should theoretically be towards myotendinous junction injuries. So why do sprinting athletes get it? And so when I say sprinting athletes, in this case, it is football players. We know that most of the injuries actually occur during high velocity sprinting in the game. A lot of this sprinting is actually below 10 meters, but it's still in the acceleration phase of a sprint. And what you can see here is that sprinting especially increases the energy absorption that needs to be done at the hamstring level, especially during the swing phase. So in the phase where the player actually has to get his foot back on the ground, he needs to break that movement with his hamstrings, and that causes large forces going through the hamstring and the myotendinous junction. And on the right here, you can also see different places where you have high strain areas in the muscles. And again, you see that in this area, for instance, you can get high strain areas in the muscle, hamstring muscle, in this area, and again also here in this area. So in different areas in relation to specific tendons, you get higher strain during maximum sprinting. So what is interesting is that actually just going from normal running to sort of high speed running, where you end up to 70, 85, and 100% of sprinting speed, the long fiber strain, as depicted here on the left with the colors, and the more sort of red you get, the more long fiber strain you have. You can see that changes dramatically when just going from 85 to 100% sprinting speed, which means that the forces that the tissue has to absorb is completely changed when you even go from 85%, which is quite high speed, to maximum 100% speed. So this is also why it's very important when we work with football players and want to get them back on the field, that it's actually very important to prepare them for these maximal sprinting speeds, which can be very difficult or sometimes in a football setting, because in a football setting you can have especially in small-sided games, you don't include a lot of max sprinting speed. So you can look very good in a small-sided game on Thursday, and then if you're picked for the team on the Saturday, it's a completely different demand, because suddenly you're not in a small-sided game anymore. Now you actually have to run on the side as a winger, and you have to actually reach these 100% maximum sprinting speed, and it's a completely different demand on your hamstrings. So again, something that is very, very important to understand in relation to football players is that something that looks like football in the training field and can be very relevant for football skills and for how you develop football fitness as well, can be very different from the actual sprinting demands that you see, especially in game situations. And this is also one of the reasons why the game situation and this it's a much higher risk exposure than just training in football, and it's actually up to 15 times higher the risk in games related to training in relation to hamstring injuries. Here again, just depicted on the right, you can see again how this myotendinous junction is actually made out of collagen. And again, just to understand that this tissue is different, collagen is different from muscle tissue, also that it heals a lot slower than muscle tissue. And as the injury actually occurs in this tissue, there are things we need to consider when we rehabilitate or even try to prevent injuries in football players, because we need to actually address the tissue which is being stressed a lot in football, which is this myotendinous junction. So again, from Copenhagen, there's been a few basic science studies where they looked at whether you can actually target this collagen tissue, and there's only a few studied at this level, because you need to take a biopsy, and it's not that easy to get the right tissue sample here. But you can see here that following 4 weeks of training, including eccentric based training, that there's actually an increase in some of the collagen markers. So it seems that especially eccentric training does have a very good effect in trying to also address collagen and myotendinous junction tissue. This is a study on rats, but what is really interesting in this study is that you can see here you have a control group, and you have a slow running group, and you have a running fast group. And again, you can just see how running fast really increases the stress on the myotendinous junction tissue, and actually increases again the contact area. So the adaptation for that is actually increased cross-sectional area in the myotendinous junction, which again would make you able to tolerate more stress in the region. So at the same relative stress, or sorry, at the same absolute stress, you would have less relative stress if you can increase the contact area. So this, of course, is only done in animals of this part, but again, just shows that sprinting itself is a really good stimuli in relation to actually also addressing the myotendinous junction. And here is a study from Australia, where they also looked at the fascicles, and this is more related to a specific exercise, and also something that might be a good explanation for why eccentric training is so important in relation to hamstring injuries. What this study shows is that if you do eccentric training, very quickly you actually get an increase in your fascicle length within 2 weeks. But what was even more interesting in this study is that if you then include a few control groups, so the control group that does concentric training, you can see that actually has the opposite effect, so that actually decreases your fascicle length. So again, something that might actually be detrimental for your fascicles in relation to that they will be stretched a lot earlier in a sprinting cycle, for instance, if being exposed to too much concentric training. So again, just showing that different stimuli have different adaptations in the muscle, and also in relation to where the injury occurs is where the actual fascicle meets the myotendinous junction. So it probably doesn't matter what kind of exercise we do in relation to try to prevent hamstring injuries that occur in a specific tissue. Here are two different exercises that has been used a lot in rehabilitation and prevention. Here's the Nordic hamstring exercise on the left, and you have the deadlift on the right. And the interesting thing is that even though you don't have a lot of stretch on the muscle in the Nordic hamstring exercise, from the looks of it, you actually have a lot of EMG activity occurring in the hamstring muscles, both the biceps and the semitendinosus. Whereas if you do the deadlift, sorry, that's a little bit too quick. If you do the deadlift, you will see that even though you put this on longer length, you will still actually have less EMG activity. So probably or mainly due to the external moment that's related to the hamstring is a lot bigger in the Nordic hamstring exercise. You get much more EMG activity and much more stress in relation to that kind of exercise than from an exercise like the deadlift. Not to say that the deadlift cannot be a good exercise, it's just again to put these things into perspective and try to understand why it is that the Nordic hamstring is probably a very effective exercise in relation to prevention. So what can we do about this? We've shown, and also another study from Holland has shown, very, very good effects of using the Nordic hamstring exercise. We did an RCT that was published in 2011 with almost 1,000 Danish soccer players. And what you could see from this study was that you could decrease injuries in the control group by 70% compared to the, in the intervention group compared to the control group. And the protocol looked like this. It was a 10-week protocol with a maintenance program done after the 10 weeks. And what you can see is that the program actually starts out very slowly and very carefully with only doing 2 sets of 5 repetitions. And then you progressively from week 1 to week 4 increase in sets and also in sessions per week. And in 5 to 10, you're actually doing it 3 times a week, 3 sets, and total number of 30 repetitions. So it's a long program. There's a fairly progressive build up, and it takes it doesn't take long, but it starts with probably 5 minutes during training, and then it goes up to 10 minutes each time you have to do the session. As you can see here, this had a 70% reduction in hamstring injuries, which is, in terms of injury prevention, that's a really, really high injury preventive effect. Usually we're quite happy if we can get to 50, but in this case it's actually 70% reduction. And these results were actually replicated in a Dutch study on amateur soccer players. Our study was in a mix of amateur and professional soccer players. In the Dutch study, they did it on amateur soccer players, changed the protocol a little bit, but it was still the Nordic hamstring exercise. They had even sort of slower progression, but over 13 weeks instead. And they had a very, very similar result, around 60 to 70% reduction again. So again, it seems that this exercise, even though it's only one exercise, if performed in the right protocol, it can be really effective and help your soccer players in relation to avoiding getting this injury. So I usually just use this example. This is an example from the Champions League level from 2013 and 14 season. This was one of the clubs who were in the Champions League at that time. This is not unusual to have 9 hamstring injuries. It's probably a little bit in the high end, but usually most clubs will have around 4 to 5 hamstring injuries a year. This club had a little bit more. As you can see, as I also showed you, most of these injuries occur in the match because the intensity and the stress on the hamstring is a lot higher in these situations. And you can see that actually led to 233 days out for this club in relation to hamstring injuries. So a lot of days out, which also, because of course the costs are ridiculously high at Champions League level, is a massive amount of money wasted in salary costs. And so theoretically, if we are able to reduce 70% of these injuries, you can see that that's a real, first of all, days out will be reduced dramatically, but also you can see that the salary cost is really, really reduced. So I would say that there is, for the clubs, a big incentive just in terms of saving money and also having good player availability in your team, because you have less days out in relation to this injury. So there's been some good injury surveillance going on at the Champions League level, and especially from the Football Research Group in Sweden. They've followed the Champions League for many years, and here you can actually see over 15 or from 2001 and 2 to 11 and 12, they followed hamstring muscle injuries and muscle injuries. And basically the trend you can see for hamstrings is that unfortunately it's going a little bit in the wrong direction. It seems that today you actually see a little bit more hamstring injuries that we had 10, 15 years ago. And that's of course a little bit disappointing, especially considering the fact that we now have more information on what can actually be done about it. And there's also been some, I would say, invalid conclusions that means that the prevention we have available, including the Nordic hamstring, is not working because the injury incidence and prevalence is going up at Champions League level. So that's actually what led us to do this Nordic hamstring survey together with the Football Research Group in Sweden, led by Jan Ekstrand. Bar and I participated in this Nordic hamstring survey, where we tried to find out whether they actually implement this Nordic hamstring program. We used Norway as a reference group as well, because the Nordic hamstring protocol was more or less invented in Norway based upon some good experience from Iceland. And they did a quasi-randomized controlled trial where they had some really good results, which were the results we actually also included in our the result from Norway was also what we included in relation to our protocol in Denmark. Again, the protocol looked like this. Unfortunately, the Nordic hamstring survey showed that only 11% of the teams were fully compliant, and up to 83% were non-compliant. So not a very good sort of implementation result, which leads me to go to the groin injury management, and I'll try to show you a bit of the same data in relation to groin injury management. Again, here we knew from prevention of groin injuries in sports that actually at this point when we started, there was no evidence for any programs being effective to reduce groin injuries. But groin problems are also a little bit different compared to hamstring problems. And one of the main things is that in this review, we only saw very, very few injuries, actually I think 140 injuries in 4,000 players. And that's because when you count an injury, it means that you actually have to be out of play. And we know that in relation to groin injuries, most groin problems actually does not necessarily mean that the player is off the pitch, and not usually that means that this is sort of the tip of the iceberg. It's all the injuries that you actually see where players are sitting out on the sideline, and the rest of the groin problems are actually all those problems being carried by players still playing. And this has been shown numerous times by our group that the groin injury incidence is much lower than the actual prevalence of groin problems, which means that time loss is not a very good definition in relation to trying to understand the extent of the problem. So we know from a screening test that especially eccentric strength is actually one of the things that is an increased risk factor. So if you have a low eccentric strength in your adductors, you're actually at increased risk of getting groin injuries in football. And this is also why we have looked very closely at specific interventions that were aggressive enough to try and address eccentric strengths, very similar to what we've done in the hamstring area. And one of the exercises we've come up with is the Copenhagen adductor exercise that actually includes an eccentric component of the lower leg and a concentric component, but also the upper leg, there's both an eccentric and a concentric component where the player actually has to lift his leg up and down in this scissor exercise. So it works really aggressive on the hamstring, and we've on the groin muscle, especially the adductors, and we've shown that the muscles are very active in this exercise. And you can see here it's almost activated up to 100% in each of these, especially on the upper leg, whereas the lower leg also works quite hard, 70% of maximum EMG intensity. So an exercise that looks very promising and quite similar to the Nordic hamstring exercise in relation to intensity. We've shown that if you do it over time, you increase your eccentric hip adduction strength by almost 40%, which is very dramatic effect. And we've taken this exercise also to try and use it in the real world, and we've been doing that in an RCT, and I'll just skip to that because I'm running a little bit out of time. So I'll skip to the RCT done in Norway together with our group. First, we tested it in a sort of a pilot study where we randomized into 2 groups and actually compared Copenhagen to the Nordic hamstring, just to see if in the FIFA 11 Plus program, just to see if that makes a difference on the eccentric strength in the hip adductors, and it actually did that. So we came up with this Copenhagen adductor protocol, and I'm just gonna flick to the data, so just bear with me a little bit here. So the eccentric hip adduction strength actually increased when you put it into the FIFA 11 Plus program, but if you just keep the FIFA 11 Plus program without the Copenhagen, you'll see no change in the hip adduction strength, so you're not changing the risk factor. So again, that seems like a good suggestion to put it in an actual program. So that's what we did together with the Norwegians. We did an adductor strengthening program where we put in the Copenhagen adduction program or exercise, randomized in 2 groups, pretty big RCTs, 632 male players from 34 teams, followed through a season. And this is how it looked, 3 progression levels, also on the pitch, so no extra equipment used. 3 levels, where you start very easy at level 1 and you go up very high to level 3. And this is the progression. So again, you start slow with few repetitions, few sets per side, and then you build up in sessions, set per side and repetitions. And I'll skip, this was the way we injury recorded, but I'll skip that and go straight to the results. This is how many reported groin problems you have when you look at groin problems. Groin problems is defined by everyone who has some kind of problem in the groin area, so it's not defined by time loss, and you can see that there's quite a lot of problems here. Only 37% are time loss, and 76 are actually gradual onset. And this is how many sessions they did, and this is during the regular season. They also did 70% in the maintenance part of the program, and this is how the data looks. And I think that's important that you see this before we wrap up. So here you see how both groups had this groin problem prevalence before the preseason. Then they did in one group, in this group, they actually did the Copenhagen exercise, and then you can see after the exercise, the prevalence completely changes between the 2 groups, and they keep a much lower prevalence in the Copenhagen adductor group, and the difference is also quite substantial, and there's actually 40%, 41% lower risk in the Copenhagen adduction group in relation to all groin problems. If you look at the more substantial problems, the more severe groin problems, we didn't find any difference. So again, just to wrap up, implementation-wise, they followed up a study in Norway, and the good thing is that when you then ask the Norwegian teams today, 91% believe that this prevention of groin problems is important and that it should include strength exercises and that it also works. They also are quite happy and believe that it only takes 5 minutes. But as you can see, we still have an implementation problem. Only half of the clubs actually perform the program as it is prescribed, and only 31% actually have planned to continue the program. So again, same picture a little bit with the Nordic hamstring. It's not that difficult to show that you can actually do something if you're going to do it, but the implementation part in football is much more difficult. So exercise does work, but it doesn't work if you don't implement it. That's probably my main message from this talk.